First, hand hygiene. Alcohol in your car, because that's all you have. Next, get your appropriately sized gown. You're gonna put this in your work bag because you're gonna take it with you into the facility. I'm also gathering my gloves, because I'm gonna put this in my bag, or my pocket, take these into the facility with me. Next, I'm gonna take my mask out of my car. I have 2 of these with holes in them, labeled clean, dirty, so I know which ones are for clean facilities, which are for dirty facilities. I also then will keep track of how many times I wear them, so I can make sure I accumulate hours and keep it clean and user-friendly. Then, without touching, the inside of the mask, I fit it to my face, 1 over, sorry about that, holding the front, 1 around the nape of your neck. Here, we're gonna mold to make sure no air is escaping. Fit check. If you feel any air escaping, reseal, start again. After that, we're gonna get on our eye protection. I ordered these off Amazon. They're perfect. There's a box of them in the car. They are reusable. You do need to clean them in between each wear. Somehow that cut me off. Okay, get my goggles on. You can seal check it as well. If you're getting fog in your glasses, it's not sealed correctly. You want to reseal it down. Oh, it's your nose. And say seal check again by blowing out your air. Now I'm ready to go in my facility. Hand hygiene one more time, in I go. Once I'm inside the facility, outside my patient's room, I'm gonna get my gown out. And make sure you tie it in the back. You'll see a lot of people loop it around and then tie it in the front again. You don't want to do that because that's not the correct way to do it. Always tie in the back, in the middle, and in the top. After your gown's on, gloves, up and over the gown to cover your wrists. Now I'm ready to see my patient. Okay, I'm ready to leave my patient's room. Gown, gloves, this is gonna be the first thing that comes off. The way that we're gonna take off our gowns is gonna be the pull away method. This is all considered dirty. You may have to pull from here to actually get it to break in the back though. So you're gonna pull away, pull it down, pulling the gown with your glove there. You're touching only the inside. So everything on the inside should be clean. You're rolling it up, you're sticking it in the trash can. Hand hygiene, leave your patient's room. Nothing on here will come off. Once you're leaving the facility, when you get into your car, this is when this can come off. You should have hand hygiene in your car. You always want to perform hand hygiene before you take anything off on your face. You'll take off your glasses from the side. You can set them down in a clean area for them to clean then. The way I take off my mask, again, this is easier because it keeps it cleaner. Around the front. See how I never touch the outside of the mask or the inside of the mask? You touch the outside, not the inside. Then it's clean. It's got holes in here to let it breathe, and it keeps it its shape in the car. If you're using a KN95, you need to have a surgical mask overlay. Your KN95s still need to be stored, but you can store those in a paper bag. You just want to keep the inside of them clean if you're reusing these. So you would take the outside over one ear, loop it around to the other ear. Again, mold it to your face so you try to get some sort of seal. Then you'll take your surgical mask in the same way, one ear over the front. You're just trying to create a barrier between anything that would splash on your mask to prolong the use. And double masking.